Well, Mike, why don't we get started? Because I want to honor people's time.
Yeah.
All right. All right. Good morning, everyone. Well, good morning for me. For some people, might be evening or night. Thank you very much for joining today. I always think that everybody's here with me in El Salvador. I am very happy to join you and that you guys come together and share this very important topic and very controversial issue for some of us, and how we can transform mental health and child protection around our practices in our countries. We have two very special guests. Bonnie will introduce them later, but welcome to this webinar, this September webinar on youth-led change. And Bonnie and I are very happy to have you here. My name is Mike Hernandez. I am the youth advisor of the Community of Practice Youth Systems Strengthening Community of Practice. And Bonnie is my co-champion. Bonnie, 10 seconds for you today.
Oh, 10 seconds. Wow, it's a long time. No, Bonnie Politz. I'm located in Washington, D.C., and I'm a youth and community strategy consultant and currently the co-champion, I say, of the Youth Systems Strengthening Community of Practice with Mike.
Thank you, Bonnie. We're very happy to have you here, and I hope that we can transform these presentations, these talks into a more meaningful conversation. We can learn from our presenters. They are experts. They have lots of experience in the fields, and we are very happy to have them here. Today's agenda, we already had introductions. We will have an overview on the YSS CoP and the Youth System Collaborative Framework. We will have the presenters share their topics and their ideas. We will have a discussion, and then at the end we will have the coming up next events at the end of the presentation. Next, please. And remember to join youthpower.org. You can register and you can connect with us. We post over the resources, webinars, articles, and some other things that you might take a look at in terms of the youth system strengthening. Bonnie, over to you. Thank you very much for joining us today.
Thanks, Mike. So the Youth System Strengthening Community of Practice has emerged out of a few things. In the revised USAID, the U.S. Agency for International Development, has a youth and development policy. And in the revised policy, which came out last year, a focus on youth systems has come into place, which is something that many of us have been pushing for a long time. The belief being that we can continue to work on programs and doing wonderful programs and learning a lot from programs, and that is where the learning takes place. But if we don't have an intentional focus on changing systems and elements of the systems, we're going to be here 20 years from now pretty much discussing the same things. So many things need to be transformed. Some thrown out and redone, some transformed, but so a group of us got together about 4 years ago who are working in various international development organizations and who are typically competitors. And we've been meeting now for 4 years on a regular basis, and had one of the members who is a researcher was able to get some funding where we spent a summer really coming up with what would a framework and the background research to that framework be, so that we could talk about what does it mean to actually change systems. And so this framework is derived from policy, both domestic, US, and international, about elements that need to be in place in order for there to be systems change. And you'll see actually, in the center is stakeholder collaboration, moving out into those other 4 elements, and then surrounded by those big pieces of the circle of policy, services and practice, norms and mindsets, and resource flows. And we believe that there needs to be attention to all of these if we're really about changing systems. You can't leave any of them out. And we need examples and to be learning from people who are in the process of making systems change about how those elements are coming into fruition and reality. So we can go on to the next slide. The members of the Youth Systems Collaborative, we actually just had a retreat together last Friday, an all-day retreat, sort of moving us ahead. These are the international development organizations that have been putting staff time and sometimes a little bit other money into keeping the Youth Systems Collaborative going. But we're also sort of a self-monitored, self-governed group where we do a once-a-month call, and each organization takes a month and they present a piece of work they're doing in a country where they are actually working intentionally on systems change, and talk about the good, the bad, and the ugly about what that is and what we can learn from each other. And then some of that will start to come out more in this next year or so. We have done a couple of workshops at different events, and to help people sort of understand, and doing hopefully a learning guide that would go along with the framework. So as we do these presentations in these webinars, we ask people to sort of think about which part of that previous circle of the framework they may be focusing on, and let us get a little more information and learning from that. So we can go into the next slide. So we're very excited to have our two speakers today. I'll start with Sixto, because Sixto Cancel and I have a long history together. I was looking back, it's almost 15 years when I first met you. And I have watched this incredible leader in our country emerge and grow and do some incredible things. He's founder and CEO of Think of Us. And it has really grown into a research and design lab that's working with a variety of very critical partners of government agencies, lawmakers, providers, advocates, foundations, to transform the child welfare system at the federal, state, and local levels in the United States. And yes, there are definitely lessons to be learned for those of you on the international side around more of the term that is used, child protection. But it is the same elements that we're going to be talking about today, and the impact certainly on young people and with young people. And obviously these two leaders are young people who are leading this dramatic change, younger than me, that's for sure. So our Telos Saint Amour, and he goes by Tay, is Executive Director of Youth Move National. And Youth Move National is a youth-led and driven chapter-based organization, which is a very interesting element to learn about, that really uplifts the voices of young people with lived experience in various systems. And that includes the mental health system, juvenile justice, education, and child welfare, in order to make sure that these systems change so that young people thrive. That is, it's an incredible mission. It's very broad. Both of the organizations' work is strategic, a little bit different in how they're doing it. So we want to learn about that and what they're learning about that. So I'm going to now turn this over to Tay, and then we will give it over. Right. And Megan just put up in the chat, if along the way you have questions, please put them in the chat. We'll stop after each sort of 10-minute presentation to see if there's any driving questions. And at the end, we'll open it up for a broader discussion. So Tay, over to you.
Awesome. Oh my gosh, thank you so much. Well, depending on where you're calling in from, right? Good morning, good afternoon, good evening, whichever applies to you. I know it's good morning where I am at currently. As Bonnie said, my name is Telos Saint Amour. It's a long name. Most folks call me Tay. My mandatory pronouns are they, them, their, and I am the Executive Director of Youth Move National. So I actually want to talk a little bit about our organization and what we do before we get into it. I know Bonnie kind of gave you a hint, so we're going to dive a little bit deeper. So I'm going to break it apart, right? Youth Move National. What does each word mean? So by youth, the youth in which we serve, we sort of define that as 29 years or younger. Mostly, though, we're working with 16 plus youth. MOVE is actually an acronym, and if you can perceive the screen, it says motivating others through voices of experience. And that's actually at the heart of everything we do. So essentially, we are working with youth who have experienced either marginalization, oppression, or harm from systems, right? So these are youth who have been through youth serving systems, so child welfare or child protective services, right? Children from sort of unstable housing situations, possibly removed or no longer with biological parents. We're dealing with youth within the juvenile justice system. So in the US, that's sort of like the criminal legal system, right? So we're helping folks within those systems. We're definitely folks helping youth who are what we would call disabled by the system, whether they're neurodivergent, right? Whether they're differently able-bodied, whether they have mental health concerns, physical health concerns. Those are the youth that we're focusing on, right? The folks who have been involved with systems, who have really experienced harm from those systems. And essentially what we're trying to do is connect them with like-minded individuals, right? To connect those youth with other youth who've experienced something very similar in order to learn from each other, heal from each other, build community with each other, right? It is a beautiful thing. And we'll get into that because that's sort of what we call peer-to-peer or peer support. And that's a big part of what we do, right? And that's sort of where our chapters come in. So essentially our chapters, we have over 50 chapters. We're in almost every single state of the US. And that is simply just youth coming together for themselves, by themselves, in their local communities, examining the issues that they face, and really trying to build something for themselves, by themselves. Whether a part of a system, whether even outside of a system, right? They have a foot in the abolition liberation movement, right? Really kind of building new systems for themselves, by themselves, together, right? Peer to peer. So that's sort of our chapter. Now, another thing we do, though, is we connect those youth voices and we amplify them with folks within systems. So those very youth-serving systems that I just mentioned, we find folks within those systems who are dedicated to change, who are dedicated to reform, who are dedicated to harm reduction. And we facilitate safe and brave spaces for them to communicate and hopefully see tangible change in our world. So when we are talking about motivating others through voices of experience, we literally mean it. We really, really mean it. It is youth motivating others through their own lived experience, through their own voice, uplifting the things that they faced. And then the last word, right? Youth Move National. So we are a national organization that's based in the United States of America. Although, gosh, our dream, our goal, dare I say, maybe 5+ years, is we are looking to go international. Already we're doing some international work. So we are working with folks in Africa, within Kenya. Oh my gosh, there is an amazing organization called the Center for Adolescents and Young Changemakers. Collins is the executive director of this organization, is an amazing person. They're an organization out of Africa just doing phenomenal work. It's been an honor to work with Collins. So if you see this organization, check them out. They're phenomenal. We've also been a part of an international coalition. So working with folks from Canada, Mexico, Australia, other countries, really trying to look at this concept of peer support. So that's a little bit about us and at least our name. So let's dig a little bit deeper. And I appreciate we move to the next slide. Thank you, because I want to talk about our vision. And our vision is Youth Move National envisions a future in which young people are valued as empowered leaders, advocates, and designers of communities that were built for all youth to thrive. Now, I place an emphasis on all because at least here in the US, we know that not all youth are thriving. We actually know disproportionately, both from statistics, from research, and those lived stories from those folks themselves, that a lot of youth are facing really extreme oppression, marginalization. And that is largely coming from youth who are Black, Indigenous, Latine, other people of color. We call this sort of the BIPOC community. From the two-spirit, lesbian, gay, bisexual, trans, queer, intersex, asexual, aromantic community, right, to LGBTQI+. We know that those folks are really experiencing disproportionate harm. We are actually seeing anti-queer and trans legislation designed at youth all throughout the United States. I just checked, and it was 494 bills. That was last Sunday. So really facing immense oppression. And then again, folks who are disabled by the system, right? So folks, whether they're differently bodied or they're neurodivergent, those are the youth who need their voices amplified the most. So when I say all youth to thrive, I mean it. We want to see all youth thriving. So we really focus on those folks who we know disproportionately are not. So that's who we are. That is our vision. That is what we're trying to do. If we go to the next slide. Yeah, thank you. So I know Bonnie brought up this awesome sort of youth systems framework. So I want to just jump in it quickly to kind of visualize a little bit for y'all where we're at with this work, sort of what sectors that we focus on. We do some policy work. So I'd say we probably dip our toes about 20% into policy work. We don't necessarily work on direct legislation policy, but we help others with their policy, auditing it, wordsmithing it, working on other folks' policy, and we do a little bit from a national standpoint from there. But mainly what we are doing is research flows, and we are doing services and practice. That makes up the mass majority of what we're doing, right? We are guiding youth, we are connecting youth, we are building resources, we are building these sort of guides and connecting folks, right? Now, if you add up the numbers there, if you can perceive the screen, it equals 200, which is not how percentages work, right? But 100% of the time, we are working on norms and my sense. The main thing that we are doing is uplifting lived experience, youth who experience this harm, and letting them speak for themselves. And let me tell you that every time they open their mouth, right, we are changing norms. We are changing mindsets. So that is embedded 100% into every single thing that we do. Okay, next slide. I know I'm running out of time here, but I'm going to wrap it up quickly, I promise you. But I want to jump in a little bit to this peer support, because this is a model that we are working with internationally. This is a model I think that really kind of applies to the vast majority of folks where you're at. And again, it's about connecting youth with similar lived experiences to talk to each other, to learn from each other, to heal from each other, and to build community, right? So this is not about getting youth to a doctor, to a clinician, to a hospital, to a diagnosis. This is about meeting youth where they're at as a person, giving them agency, listening to them, right? And connecting with them empathetically, right? As simply another person. So what we call that is sort of peer support. And that is the main thing that we are doing, is connecting youth with themselves, with folks with similar lived experience, to work together on healing and learning and community. So we've got a lot of resources from you. You can learn more about peer support, but I want to move on to the next slide, because we do peer support a little bit differently than most folks. Now, we know a lot of people are passionate about this issue, right? So passionate. That is awesome. That's amazing. We welcome folks who really want to help. But to us, a peer means a peer, which means matching as close as possible those lived experiences, right? So if we're dealing with a youth who is 16 years old, a peer would be someone who is also 16 years old, right? It's someone who is matching and aligning as close as possible to their age. If we're dealing with a youth who maybe is having sort of like, mental health crises, or dealing with sort of neurodivergent, or is just having issues navigating systems because their mind works differently. Well, guess what? A peer would be someone going through the same thing, right? And so again, a peer means a peer. So it's really about matching folks as closely as possible with their identities that they hold in the ways that it makes sense, right? A cutesy thing, if you can perceive the screen I've written, is that if a 14-year-old would not receive the same treatment as a 24-year-old, guess what? They're not peers, right? So it's a big thing that we focus on in peer support. If we go to the next slide. Okay, so I'm going to wrap it up. I'm going to hand it to Sixto, but I want to talk about tangible things that we've done, right? So far, I've been very 50,000 square foot. I've been very broad. So let's get into the nitty gritty. So one of the things that we've worked on a national level is we worked for the Center for Law and Social Policy, CLASP. That's a U.S. national nonprofit or non-government organization. And we assisted in really defining that youth peer support, what it is, what it looks like, right? And so we actually worked with them to do a full policy report. We can drop that link for you. It's fantastic. I'm so proud of it. CLASP, check them out. They do phenomenal work. Another thing that we work on is we work with SAMHSA, which is the Substance Abuse and Mental Health Service Agency. That is a governmental agency of the United States. And we really assist them in defining what those national youth peer support standards look like and giving them recommendations, right? We worked with a bunch of other organizations that worked with our federal government to do this policy. And again, we've got the report for you. We're going to have some resources. We'll drop that link as well. Can we go to the next slide, please? Okay, and this is the last one I got for you. I promise. Sixto is amazing. I'm so excited to bring him into the space. So 3 more things I've got for you. We've worked with WNAT, which is a for-profit company here in the US, but really they were working to inform Medicare with reform, which is really a sort of social safety net that we have set up in the United States, which helps fund mental, behavioral, and physical health care, right? So we really worked with them to kind of get some reform measures in place when it comes to peer support. That report is not fully published yet, so we'll hold off on that, but check us out in 2024. We're also training states here in the US, and we're looking internationally on, again, diving deeper into what that progressive youth peer support can look like and building folks up in the workplace, right, in that workforce. It's so important that youth get paid for the work that they do, right? We all of us are valuable, all of our labor is valuable, and all of us deserve to make a living wage for that, whether you're a youth or an adult. And then lastly, our chapter networks are growing and transforming those local initiatives. Again, we are doing some amazing creative abolition liberation work movements. So check out our chapters. We'll drop that link as well. Okay, that is exactly my time. If folks have questions, we'll answer it later. But Bonnie, I bring it back to you.
Wow. Wow, wow, wow. We went through this in a run through. Yeah, I know. And it was amazing to hear, and it was your energy and your commitment and your, I don't know, your advocacy is so important in our country, in our world right now. So thank you. I don't know if there's any questions that have come up, or if somebody wants to raise their hand to just ask just a quick question of Tay before we move on to Sixto. If you want to, you can raise your hand and we will connect you. If not, we're going to move on and you'll have time at the end. Okay, so I don't see anything. So Sixto, there you go.
Well, everyone, I'm just so excited to be here. And, as we prepared for this and I got to learn a bit about what are the type of organizations that come here, it was just so inspiring. And so, first of all, thank you all for the work that you do. It's how innovation happens across the world, is that we get to see a glimpse of magic. And so today, I'm super excited to share a little bit about the work that we're doing and honored to be in this space. So my name is Sixto Cancel, and I'm the founder and CEO of a nonprofit called Think of Us. And what we're focusing on is how do we transform this thing called the foster care system here? And what the foster care system in the United States is a process where when young people can't live at home with their parents, because there might be some abuse, there might be some neglect kind of challenges, that then another family that the state licenses, the state actually appoints them to be able to take care of children that are in the state's custody. And so this literally looks like a house with a family or apartment with the family where you literally would go and live with them and then have a relationship with a social worker who comes and visits you. And so that journey began for me when I was 11 months. I was placed in the foster care system due to my mother's struggle with addiction and her mental health. And then I was adopted at the age of 9, but that adoption didn't really work out for me. So I was back in the foster care system when I was 15 years old. And then I ended up turning 18, becoming an adult. And soon after that, end up what they call aging out, which is basically you're too old to stay in the government's custody. The government is no longer your parent. And now you have to kind of figure out life on your own as a young adult. And so next slide, please. And so that experience inspired me to really think about how do we actually fix this process of a government to being a parent to a child, figuring out how do you improve that process, because the purpose of you going into foster care is one where you have to, the government is working towards either bringing you back home, reunifying you. If going back home is not possible, then how do you extend your forever family through adoption? Right? And how do you build those permanent connections to a set of adults who can be like a family-like network? And so it is not a thumbs up when a child ends up leaving the system without those permanent connections, without that family-like network, without being part of a community that they actually belong to. And so to solve this problem, we launched what we called the Center for Lived Experience. And what this is, it's a research and policy center. And the reason why we did this was because what we realized is that there were some aspects of the problem we didn't understand enough. We knew the impact of what it meant to navigate, from home to home to home, different families, and end up aging out. But we wanted to understand just a little bit more. So we launched this Center for Lived Experience that focuses on doing some research and data, but it focuses on doing research that is uniquely about interviewing and engaging those with the actual lived experience of being in the foster care system. And then we have our second pillar, which is about community building, which is really making sure that we're in relationship with the hundreds and thousands of young people and advocates and folks who work in government across the country, so that we're just not extracting information from them, but that we are actually in relationship and providing them with supports and needs. Awesome. And then the last piece here is what we call proximate policy. And the reason why we added proximate in front of the word policy was because what we wanted to do was not just point to here's what we're advocating for in terms of a policy change like a law or a regulation, right? But what we wanted to do was say, when we approach a change around policy, that we have checked in with the young people. We have checked in with those who have been impacted. And so now I want to give you like one example here. And I believe that this example could definitely be done in multiple communities, because the important piece of this example is about listening, together interpreting with the people who are impacted, and then being able to share those new insights and that new understanding of a problem with folks who are trying to make decisions on that particular problem. Next slide, please. So one of the things I am very passionate about, and one of the things that came up, is that we envision a system where the majority of young people, when they come into foster care, right, the social worker has said, hey, it's not safe for you to be at home. We're going to bring you into this system. We're going to place you with the family. Well, most of the time, when you're being placed with the foster family, right, the government is putting you in the custody of a new family. Those people are unknown to the child. And so only 34% of children in the United States who are placed in foster care are actually placed with a relative or someone that they know. And what we want to do is make sure that that number is closer to 80, 90%, that young people are living with people who can love them beyond the contractual agreement of a license with government, things of that nature. And to do that, there's one big challenge. And that biggest challenge is that there is a mental model, a mindset that is around how people believing that young people may not have adults in their life. So I want to go ahead and hit the next slide, please. This is a quote from one of our interviews. So some of the things we would do with young people for a problem like this is that we would literally go ahead and make an application on a Google form and then put it on social media, ask different agencies and different nonprofits to send it out. And then we would go ahead and start to interview people about their experience. And here's a quote related to this particular topic. All I ever wanted was a family, but I was told I was too old, so I was kept in a group home until I had aged out. I wasn't given the necessary things or resources to survive once I got out. And I got kicked out of my program for not being productive because I lost the will to live, because I didn't know what to do with my life now that it was my own. So some of the mental models, some of the things that are driving people's behavior is the belief that when young people are teenagers, that they should just prepare for young adulthood. And that means sometimes they're not actually including them in helping talk about things like adoption, or talking about things like extended family members who can be part of that family-like network for that child. You want to go to the next slide, please? So the question becomes, how do you combat this? And so one of the things that we did was we started off on a project called Project Leapfrog. And it was to really, truly understand this notion of being too old to have family. It was this notion of that young people do not have supportive adults. And we wanted to know if this was true. So we went to 5 different places in the United States. And then what we did is we interviewed over 209 folks to understand their stories, what were some of the things we learned. And then most importantly, we tried to reach young people in the mediums that they were most comfortable with. And so we did a couple of different type of workshops, and I want to share with you these workshops here. If we go to the next slide, what we realized is that we could not ask young people. We failed 3 times in creating the right workshop that would actually bring forward the information we wanted around, do you, as a young person in foster care who's a teenager, who's getting ready to age out, do you have supportive adults in your life? And that conversation was so hard for it just to be an interview. And so we designed a workshop, and it took 3 times for us to get it right. And the first thing we realized that we had to do, we had to start with the highest safer thing, which was to do an activity in that workshop where we asked young people just about their hopes and fears. And here you see that this young person, and we have like 200 of these, by the way, and you'll start to see themes between all of them. And you'll see that this young person talks about their hope is to graduate college, to know the people that they can rely on, family, financial stability, to get out of the Bay Area, which is a place in California where they were being raised, right? To find a lucrative job, to learn how to drive. And we saw that some of the fears here was lack of motivation, fear of not graduating, loneliness, substance abuse, falling out with family. And so we had young people do this type of activity, and then they began to talk to each other about their hopes and fears. And one of the things that was just so powerful is in that moment, you can tell when young people were like, wow, I am not alone in these feelings. And yet sometimes this was the first time that these hopes and fears were being vocalized out loud. And what that did was it started to allow the folks in the room in that workshop to have a more intimate moment. And what we also did was we made sure that the facilitators and the person conducting the user research with us, that they also were being authentic about their hopes and fears. So that then we weren't just asking people, but we were also participating in that. Next slide, please. Then we asked young people to do a more fun activity to be able to lift a little bit away from the feelings of what it might have been to actually talk about those fears, right? And we did things like say, well, if there was an app, because as we know, young people like phones and apps in our community. And we said, what would be some of the features in an app that would actually solve to this? And so young people made, again, like 200 different, we have 200 different drawings of like young people's version of an app here. And it talked about savings. It talked about how you can, navigate the medical system. How do you do your taxes? And so young people were coming up with solutions in that room and then discussing those solutions. And then we went to the last piece of this exercise. If we can go to the next slide, please. Which was about actually having them start to map out the adults in their life. And what we found were themes like young people did have adults in their life, and that they actually had different mental models around the closeness that they had with them. So if we go to the next slide, here's one example that we did get permission for all of these to be shared. But here's one example when we would say, hey, map out these supportive adults in your life. Well, the challenge is that young people would feel overwhelmed and sometimes would be like, I don't have any supportive adults in my life. But then when we start to change the question to say, just map out the adults in your life, all of a sudden we would see faces and names come up. Then we would say, hey, categorize them into what type of adults. And you can see here, there's foster family, there's friends, there's siblings. And then we said, hey, put green next to anyone that you feel close to. Put yellow anywhere where you feel like you can get help. And so we started to see that young people did have this network, but because of the way that the foster care system in the United States work, they're not prioritized. And what that means is that sometimes the social worker is not arranging for you to have the transportation to go visit that aunt, to go visit people who they may not be in a position where they can take you in, but they can still be in your life. And so our system has to be able to improve to say, you know what, as a state government agency, we will pay to make sure that you have the transportation to see these other important relationships. If we can go to the next slide. What we also learned about another mental model is that the paid staff at these nonprofits became a part of their family, are becoming part of their network. And we saw this in network maps like the next slide here. Here you'll see this young person drew out, their family, they drew out their friends. And in the middle of this drawing, you see here, you see Sarah, who is what they call an independent living program specialist. And this independent living program person is responsible for teaching Sarah, her name is Sarah, teaching this young person how to, get a job, how to drive, how to learn how to cook, these very foundational life skills. And so it's what we saw time and time over again, is that we have, we saw time and time over again, is that we see how paid staff now start to become part of the family network. And then if we can go to the next slide, the last mental model that we really saw here was the importance of peers and siblings. And in the United States foster care system, we've kind of underestimated the power of friends for young people and the power of siblings. In many states in the last 10 years, so there have been some state legislations that have passed laws around like the right to visit your siblings, which has not been something that every state has passed or that is guaranteed for a young person who's placed in foster care. And if we go to the next slide, we can see that this young person drew out their network map where siblings was just so critical to them. Well, maybe I forgot that slide. But the point is that, siblings and friends are also needing to be part of the conversation. And right now, in many states and in many budgets, those transportation, the ability to see the folks are not part of that. So in order to solve those problems, we need to dig deep to truly understand and reframe the problem around young people not, quote, having adults in their life who could be supportive to them. What we found is that those relationships are there, but that as a system, we need to alter the rules, alter the funding to be able to support making those connections and then having those connections actually develop further. So that's a bit of how we merge the world of research, merge the world of young people having voice and choice, and being able to show how is it that you can change a system.
Wow.
Bonnie, back to you.
Wow. I will say something that we didn't talk about in our prep for all this is that these two incredible people did not know each other before we started this, I think. Is this true? And your organizations are both doing such independently progressive work, and yet there's definitely some overlap in terms of, and certainly in your underlying perspectives on what needs to happen in some of the populations you're working with. So I hope there'll be some connection afterwards. We can't do anything about that, but that's what I would hope, because I think the two of you together testifying at a state legislature or at Congress or wherever, or doing some, joint things. I mean, you're powerful. You're powerful. So I'll ask you this question, because there is some connection and yet some difference. Was there something you heard in each other's presentation that sort of you went, oh, aha, or that's something I really want to follow up on? Either one of you.
Oh, yes, I had an aha moment when, and I quote, when you said 100, these percentages may not add up, but 100% of the time we're working on mental models. And I thought that was so important, because what that said out loud and it made me think is like, wait, 100% of the time you're working to touch people's minds and hearts. And at the end of the day, these issues are so human. And sometimes we can get so tactical in trying to find solutions that are very surgical and like, let's change the eligibility, but to remember and center that this is a heart and mind. And yes, we need those tactical things. It's so important. So that really stood out to me and challenged me to be like, oh, I need to be thinking about how I frame for my teams, that it's also about the hearts and minds at all times.
Oh my gosh, I love that, Sixto. Thank you so much. And I think for me, when you were bringing it really home, is how you made it so personal, right? Like sharing, welcoming us into sharing some of your story with us, which was just so precious. Thank you for doing that and for trusting us with your story, and the ways in which you highlighted that direct work you've done with youth. The pictures were phenomenal and like really highlighting, right? I'm talking about like lived experience broadly, and you're like, I'm going to give it to you. Like, here's some pictures. Like, let's get into it. Like, let's look at what these kids did. I just thought was like phenomenal and like deeply touched my heart. So like, thank you for bringing that perspective. I deeply appreciate you, my friend.
Thank you.
Great. I see somebody's hand raised, Mike. Is that Maria Sophia? Would you be willing to come on and ask your question or whatever you'd like to say? Can we open her up? We don't have to. Okay, well, maybe she doesn't. That's right. If you want to put something in the chat.
Bonnie?
Yes.
Stephanie has a question here. What have you seen as some effective ways to shift those hearts and minds and have emotional resonance alongside this incredible evidence?
Yeah, I mean, in our work, it's been the combination of having folks with lived experience be able to tell a part of the story. Then secondly, having a bit of data that is kind of a couple of different data in our world. Data around the system itself, what is the impact of the problem? Data around the financing, which I think we forget so many times, and I've learned the hard way of like, we have to talk about the money implications of our recommendations also. And then really being crystal clear. I know this one is one that I always am shocked at from ourselves, that like we always have to do the exercise to tie the problem that is being presented with like a black and white 1, 2, 3, 4 connection to the solution, and then to be able to put it in the lens of that story that the person is sharing to like really understand folks. What I realize is these problems are complex. And when you're talking to folks who may not understand, giving them the benefit of the doubt of being like, they truly just don't know. Even though you're like, sometimes you might be like, how the heck don't you know this? You know? But to have that patience and to provide that grace and to provide that structure has worked for us.
That's great, Sixto. I appreciate that. And yeah, I think I would take a similar approach. I mean, I think the first thing that's really important to do is find common ground, is find that foundation that you both agree with, that you both relate to, right? So typically when dealing with folks who are advocating on behalf of youth, but maybe taking divergent paths on an issue, try to come together at that center point to be like, hey, we're here talking because we care about youth. We're deeply passionate about youth. We are trying to like reduce harm of youth and uplift youth to have love and to thrive. And so focusing on that like foundation, that center, that core, to get mission and vision aligned, if you will, and build that foundation strongly, I think is a start, right? And then you can start working up to those things that you are sort of like diverging on as far as hearts and minds, right? So I'll give you a very clear example. So I work with a lot of youth who are queer and trans, right? Who are in the 2S LGBTQI plus community. And a lot of folks are worried about gender affirming care for youth, right? It's a big thing that's being legislated against in our country. And some countries literally don't even recognize that queer and trans folks even exist, right? So this is a big issue that we see globally. And a lot of the times what we're hearing, right, is we've got that foundation of we care about youth, we care about kids, we want to see them thrive, right? So we find that, we focus on it. And then it's about understanding, like Sixto said, bringing in some of that data to say, well, if we care about youth, let me tell you what we have to lose. And what we have to lose is lives. Because data, research, statistically, we know that, and I'm going to talk about some heavy topics here, so a bit of a content warning. The suicidal ideation, the death by suicide that we see from kids is astronomical in the queer and trans community. It is disproportionately off the charts. By some extents, it is 7% larger than their cisgender or heterosexual counterparts. And so if we have that foundation of love, this is what we have to lose. We are losing lives. But what do we really have to gain, right? We have to gain that child thriving, that child feeling seen and validated and beautiful and getting to be themselves, right? So if we find that foundation, it's sometimes easier to change that heart and mind by saying, let's now examine. We both agree we love kids, we want them to thrive. So then let's examine what we have to gain and what we have to lose. Because we don't really lose anything by trusting kids to have that agency, to know themselves, to advocate on themselves, and to say, I know who I am. This is who I am. Why would we ever want to tear that down, right? We have all the things to gain, but what we lose is life, right? And so really, again, foundation, build up slowly, and then really, like Sixto said, put it in black and white. Pull in some data, pull in some statistics, right? Folks are dying, right? Let's talk about that. So that's an example of kind of how we do it. Hopefully, if that makes sense.
Makes a lot of sense. Makes a lot of sense. I'm just trying to see if there's any other questions of people. Again, if you want to raise your hand and come in, if you want to put something in the chat. People are very motivated. Someone, Dr. Amir Zada says, I belong to Pakistan literally after this session and such an amazing speakers. I'm very much motivated. And I want to work with Youth Move for the betterment and empowering of youth. So we hope there will be, please reach out to both Sixto and Tay. I mean, I think this is what this is all about, to make these connections. And, you're both talking about, you keep talking about the human element of this and the connection. And I think about policymakers, and I think about, sitting in, city council meetings or in, meeting with lawmakers and things. And so, I mean, are there ways, do you bring some of this personal connection, what you're learning? I mean, is that through the young people that you bring with you because they are there? It isn't just you going? Or do you ever take them through some of the exercises, some other adults who are not involved in this on a regular basis?
I can go first, Sixto, if you want me to. So yeah, 1,000%. So at the core of what at least Youth Move National does is we amplify voices. So I'm getting older. So a big part of my role is to advocate on a large scale, but then know when to take a step back and let you speak for themselves. That's mainly what we do. So if we're talking about like advocating in front of folks, important folks, really getting up there, I'm not in the one in the chair. The youth themselves are there sharing their story, right? However, I think the nuance there, and I think Sixto speak to this like a little bit, is that what we want to also avoid while we're amplifying voices, while we're empowering voices, while we're centering those voices, is we want to avoid voyeurism and tokenism. So we have to ensure that it's a safe space, that they're doing what we sort of deem as strategic sharing. Like, how do you share your story in a way that's not activating to you? It doesn't do more harm. It's not as activating to other folks too, right? A lot of folks have trauma, but it makes that personal connection, right? It touches our heartstrings, but doesn't do it necessarily in a way, right, that is sort of trauma dumping or is just like, look at me, I'm someone with trauma, I'm in a zoo, examine every element of us, right? So we uplift, amplify, empower youth voices to speak for themselves, but within a container that is safe, that is brave, that allows for some of that trauma to be reduced. So it isn't, again, sort of that like expletive sort of like, let's really like exploit your story. So that's kind of how we would do that and uplift that, at least in policy work. Sixto, I don't know how you feel about that.
I'm totally aligned with you. And I think that, one of the things that I'm trying to think through is how do we even push our sector here in the child welfare of the United States to really start thinking about how do we train young people to not just share their stories in the most strategic way, but to become mental model shifters, to learn the techniques about being able to read that room. Are folks feeling uncomfortable? How do you have the grace to be able to extend to the folks in the room and pull them into difficult conversation and to be able to go back and forth with the material? I was at a conference and, I framed my whole entire presentation in a set of questions. I don't know if it's best for young people to live with their grandmother, uncles, and aunts. Now, I do have a strong opinion about it, but I framed the question and the conversation in that way so that it would invite conversation for those who may have felt it was too unsafe to ask that question. And when we were able to do that, one judge said, look, I believe in family and I believe in placing a child with a family member, but I keep placing them with a stranger who's licensed by the government because I know at least that person went through training and I don't have any information about that family member. And so when he said that out loud, then other peers of his, judges, were able to say, well, here are the questions that I asked. Here's how I think about it. And so the power of being able to create those safe spaces, like young people can bring those type of conversations there and can facilitate those type of conversations in such a way where folks feel and are compelled to think deeply about how do we get to an answer, even if they are feeling uncomfortable.
Yeah, got it. Okay. One thing, Sixto, somebody's asked for your contact details. If you or Jay could put it into the chat, please.
Yep.
And there is a question. Mike, you want to take that question? Just came up.
Sure. Raymond says, this is for Tay. What are some of the ways that your program promotes resilience in youth?
Ooh, that is a great question, Raymond. And I'm going to say it is kind of a big question for me, and we only have 5 minutes, so I'm going to try to reel it in. First of all, I want to speak to this term resilience. And this word, to me, along with sort of things like centered around hope or self-care, I'm finding to be like very big buzzwords in our field, at least in the US, where folks really want to talk about, oh, what do you got to do to self-care? Or you just have to have hope, or stay positive, you're so resilient. And what we do is that we recognize that sometimes this word and words like it can actually be a little bit toxic. We sort of view it as burden shifting, right? So if you see a system that's doing harm, right? Instead of wanting to abolish that system or work on reform of that system to stop that system from doing harm, what we sometimes do is burden shift and then place the spotlight on the youth to say, oh, but look at you. You're so resilient. You've experienced all this harm and all this trauma, but it's a gift. Look at how you used it to build yourself up. Look how you used it to become this awesome. You're so brave. You're so brave, right? But meanwhile, the system keeps doing the harm. So it's almost like it's this, again, this burden shifting idea. We're passing the spotlight to avoid accountability of the system actually changing. So one of the ways in which we build resilience in youth is one, just sort of recognizing that yes, hope is important. Positivity is important. Resilience is important. Self-care is important. All of those things are awesome and amazing, and we work with you to build that up. But we also want to hold the system accountable for changing, the system accountable for stop doing that harm. And one of the ways I love picturing this is if you sort of go into Google and you type in resilience and you do Google images, one of the main things you're going to see is a piece of concrete with a single plant growing up over that concrete, right? It's a classic image I think most of us know when we see that term resilience. That is not resilience. That is survival. And there's a difference between surviving and thriving. And so we want to celebrate when folks are able to thrive, not when they're able to simply just survive, right? So that's sort of our take on it, if you will. And I know that was a bit of a soapbox.
Wow. Got anything quick, Sixto, you want to say to that, or not? You don't have to. You just
I think Art could drop the mic there.
Drop the mic. Wow. I mean, this is one of the webinars where I think we probably could have gone on a lot longer and let's think about that for something else, okay? Because this is hopefully not the last time we will be together with both of you. And I just, I mean, I can't thank you enough. I mean, as a US citizen and a citizen of the world, I'm so glad you're with us because, you know, last night on the news in Washington, D.C., it's that we've had, you know, almost 200 people, over 200 people killed in Washington, D.C. this year, way beyond what we're normally. And a lot of this is juvenile deaths and juvenile crime with guns. And, we're in the midst of just a difficult time, and it impacts a lot of the young people that you're involved with in all of these systems, and we got a lot of work to do. So thank you, and I'm glad you're with us. So Mike, you want to take us out?
Yes, we appreciate all the comments in the chat. And if you want to connect, please join the youthpower.org. Find us over there, and we can continue this conversation in a blog discussion, in a post, and we will be more than happy to continue discussing and sharing Telos and Sixto's work. You guys are awesome. Thank you very much for joining us today. And coming up next, we will have tools for cost reporting and analysis of youth development, featuring Melissa Donaher, monitoring, evaluation, and learning specialist with USAID Centers for Education, next Tuesday, October the 10th on Zoom.
Yeah.
And for more discussion, follow youthpower.org.
Right. And I just wanted to say on behalf of Mike and myself, this is the end of the US government's fiscal year. So this is our last webinar for the 2022-23 year. And we are awaiting word about how this will move into the next year. Starting October 1st will be the last year of this Youth Power initiative that's being funded through USAID. So we're all anxious to hear what's going to be happening after this, but we will let you know as soon as we know what's going on with our YSS CoP work. And we just hope people will stay connected. And this will come out on YouTube, so you can share this with folks where you live and have your own discussion about these things. And please reach out to Tay and Sixto. I think this is, again, it was very exciting to see all the connections. And that's it. Thank you all. We're right on time.
Muchas gracias a todos.
Muchas gracias.
Thank you very much.
Thank you.
Thank you, everyone.
Thank you for joining us today.
You're welcome.
Okay. Thanks, Catherine and Megan.